Pandemic's taking a toll on a lot of us, but no more evident than our most impressionable, children. There are rising concerns about long-term impacts the pandemic could have on children's mental health. News 4's John Chandler takes a look at the kids in crisis coping in the time of COVID.
2, 1, Sarah, you're in.
Laughter. It's one sign kids are all right. But laughter is something parents have heard less of lately.
Do you have all your passwords written down for the day?
In the pandemic, children are often frustrated by remote learning and isolated from friends.
Can't do anything, stuck inside.
Jake is a third grader who really misses school.
I can't see anyone because of coronavirus. Lots of people are dying. My grandparents had it, so did my cousin, and they both recovered perfectly fine. So I'm very happy about that.
Were you scared?
I was very scared.
He's not alone. Since March, 70% of kids 5 and older feel more worried, overwhelmed, and sad. So Jake's parents see his time in Central Park with their tree bath learning pod as an essential outlet.
Oh, yeah?
I think when you get into like second, third graders, and especially older kids and teens, they have a sense of what school is and they know what they're missing.
Chase knows that feeling. He spent more time at basketball practice than inside his 8th grade classroom this fall.
I've been at campus probably like 8 times.
That's it?
Yeah, and the schedules are just changing from moment to moment, and it's very unpredictable.
So unpredictable, his family's home tutoring business, Brain Trust, is surging. As families try to counter the inconsistency of schooling, and studies show the pandemic's pressures are real for kids. According to the CDC, emergency room visits for mental health are up 24% among children 5 to 11 years old.
The knowledge gap since March is just growing and growing, and so many students who would have been okay are now, decidedly not okay.
This might be part of the problem. For months now, computers and iPads have turned into kids' classrooms. And inside a Zoom room like this, there's simply limits to how much you can learn and how much you can interact with your teacher and your fellow classmates.
We've been saying for years, like, get off the screens, get off the screens. And now necessarily you have to get on a screen in order to learn.
Dr. Rachel Bussman is a clinical psychologist at the Child Mind Institute.
I also think there's a piece that is really stressful for kids in terms of the shifts or the quick transitions in remote learning.
She says pay attention to kids' sleep, moods, appetite, stay calm, and most importantly, listen.
Sometimes your kids will actually say, I'm struggling, like I'm having a hard time.
Are you feeling a little sad?
Seth closely watches his kids, ages 6 and 4, as they play in the park with Jake.
My biggest worry is really their mental health. Will they feel safe and secure while the world is in a very difficult place?
Underneath his mask, Jake smiles and thrives playing in Central Park.
Fun climbing rocks.
And he's eager to get back in his classroom.
Yeah, I really hope so, but I know it's never going to really go back to normal.
Why is that?
Because, normal's gone.
Nearby, his mom offers reassurance.
We can't promise as parents, everything's going to be fine. We don't know, but at least we can give them, yeah, you're going to have a warm bed tonight, and you're going to get tucked in the same way, and all that stuff will stay the same.
John Chandler, News 4 New York.
All right, we're glad to see them playing outside for as long as they can because we know that helps so much.